information, and then we'll open it up for questions. We and I guess I should introduce myself. I'm Angie Pina. I am the director of DSPD, so I'm really glad to be able to spend some time with you, have my team spend some time with you, so that you can hear from us and we can also hear your feedback and questions. We are working to make these meetings more accessible to those who speak other languages. If you'd like to try the closed captioning in another language, right-click on the closed caption box on the bottom right of the screen. A menu will come up and then click on Translate into English. A box will open at the top of your screen where you can choose what language you would like the captioning translated into. We also have someone here to help translate questions for Spanish speakers. Before we get started today, we wanted to remind you that this meeting is being recorded and it will be available Friday on the DSPD website under the Individuals and Families tab, and then the Be Informed and Be Involved heading. Please mute yourselves and type questions in the chat box. You can also raise your hand. We just want to be able to kind of manage sound. I'm going to give a minute to David so he can translate that piece.
Okay. Buenos días, bienvenidos a nuestra reunión familiar de autodefensa. Esta reunión está siendo grabada, así que le pedimos por favor ponga su micrófono en mudo. La grabación la puede encontrar el próximo viernes en nuestra página de internet para verla ya en dspd.utah.gov. Luego presione en Individuals and Family Resources y Be Informed and Involved. Presione en Family and Self-Advocate Information Gatherings, donde puede encontrar la grabación de la última reunión, así como reuniones pasadas. Estamos haciendo todo lo posible para tener esta presentación en otros idiomas, pero por ahora solo tenemos disponibles los subtítulos. Si desea usarlos en español, siga lo siguiente. Presione el círculo que tiene los 3 puntitos. Presione en la cajita de abajo que tiene las 2 CC mayúsculas. Presione la cajita de la derecha que dice English Caption Settings. Va a salir una caja en medio de la pantalla y presione Translate Captions y verifique que se ponga azul. Presione la cajita que está debajo y escoge el idioma que desee que esté en los subtítulos. En este caso, seleccione Spanish. Presione la X de la esquina de arriba a la derecha. Los subtítulos estarán en español cuando la persona esté hablando. Si tiene alguna pregunta, a la mano derecha de la parte de abajo hay un cuadro con líneas, como si fuera alguien que está hablando. Presiónalo y saldrá una segunda pantalla que dice Incoming Messages, en la cual usted puede escribir su pregunta en la parte de abajo y hay una línea donde dice Send Message to Everyone. Ahí usted puede escribir su pregunta en español y yo la voy a traducir. Luego presione la flecha para que podamos ver. También puede hacer preguntas en voz alta. Solo presione el círculo que tiene la manito y le haremos saber cuándo usted puede hablar. No se olvide de presionar el micrófono para que lo podamos escuchar. Si desea, puede mandar sus preguntas por correo electrónico de la reunión a dspdinfo@utah.gov en español. Estaré presente y disponible durante toda la presentación en caso que tengan preguntas. Gracias. Back to you, Angie.
Thanks, David. Okay, our agenda today will be we'll have some announcements, go over staff changes, we'll have some legislative updates. I know there are questions right around caregiver compensation, coming off of the waiting list, as well as temporary services for those who are on the waiting list. We'll have some person-centered planning training and then community resources and time for questions and answers. So we'll just jump in with our announcements. The first one is that the Institute for Disability Research Policy and Practice, which is at Utah State University, is doing a survey. This survey is about sexuality, relationships, and people with disabilities. They are hoping for responses from this survey from adults with a disability, family members, and service providers. We'll share the survey link in the chat. If you're interested in taking or sharing it with families and individuals you serve or engage with, it'll be there for you. We are currently in the process of working to redo the DSPD website. We want to make sure our website is accessible and user-friendly for everyone who uses it. We have a survey you can take to let us know about your experience using our website, what you like, and where there's room for improvement. So we'll put that in the chat as well and would really appreciate your feedback and input. Circle of Friends is a recreational and social program developed for people with multiple disabilities and some degree of hearing loss. Their goal is to help support opportunities to develop independent living and social skills, help people participate actively in community life, and decrease isolation by socializing with others who use sign language while having fun. You can learn more about this program on their website, which we will put in the chat. We have a pilot project to gather feedback on people's experiences during the person-centered planning process. We will be reaching out to people to find out how their meeting went. You can be contacted via email or mail to ask for your participation. It's a pilot project, so if you're interested in participating and we haven't reached out to you, you can contact us, and we'll put the link, the email link in the chat as well for you to contact. It's PCP pilot project at utah.gov. And then our final announcement is that we have directed support coordinators to resume in-person visits so that we're able to see how people are doing, make sure they're well. There is still we still have Appendix K, which allows for a COVID response for something that's directly related to COVID. But we are expecting those to be in person. So on our staff changes, we've had a few changes. Anna Dees is joining our intake and referral team. So as people are calling to get information about services, Sandra Hernandez is also joining that team. So we have those two new staff there. Heidi Johnson is joining our finance team. She'll be helping track our funding, make sure our reporting is done. While you may not all interact with her, we definitely find that role critical and helpful for us to operate. Amanda Marine has joined our contracting team. That's with Becky Dalby. And that's really great for us. It's going to be able to help us keep on top of our contracts, get our contracts out that are needed. We have Chad Midgley. He's worked for DSPD for a long time. He's done a lot of our reports. He has taken on a new role as our business analyst supervisor. We're really excited to have him. He's very good at kind of planning projects, having a task timeline, and getting things done. He's really a great resource, and we're excited that he's accepted that position. We have Tenzin Sopa, who is also on our finance team, helping us keep track of everything, make sure we stay solvent so that we're able to continue to provide services to people. And then we have Brianna Salazar, who is her role is helping people with those one-time services on our waiting list. So we welcome all of them and hope that all of you who have interactions with them, your experiences are great. We're really excited for them. So on our legislative updates, caregiver compensation was funded as an ongoing service through the legislative process this year for people in DSPD services. We're still in the process of figuring out details of how the program will work going forward. Right now, all of our allowance has been under the public health emergency. So there are things we have to address moving forward. Some of the changes we need to make on our end are we have to update our rule. We need to amend our waivers so that we're allowed we have to have the Centers for Medicaid and Medicare Services approve this change in our waivers as an ongoing service. And we have to define extraordinary care. So we are working on all of those things. And we wanted input from families and individuals, support coordinators, and providers as we make decisions about caregiver compensation and how that looks as an ongoing service in our state. Many of you already filled out a survey about caregiver compensation earlier this year, so thank you for that. One of the things that showed is that with caregiver compensation, families experienced an increased quality of life for both the caregivers and people receiving services, and that it lowered stress for families and decreased a financial burden. We've also heard recently from many families who like using the provider model for caregiver compensation. And so we're taking this feedback into consideration as we're planning. While we don't yet have details to share with you about the changes to the caregiver compensation program, we are hoping to implement these by November 1st of 2023. And we'll continue to communicate with you via email and through these meetings as we have more information to share. The structure of the program could change. Also, just common questions that come in, we just want you to know we cannot give tax advice about caregiver compensation. If you have questions, please talk to your tax professional. I'm going to give some time to Jamie Douglas to talk about like people coming off of the waiting list and the one-time services on the waiting list.
Hey everybody. So the Utah legislature included $3.6 million in ongoing funds for the fiscal year 2024 budget for the DSPD waiting list. We'll be bringing about 19 people into services each month throughout the whole fiscal year. The first group will start receiving these services in July. We will be contacting people if you have been selected to receive these services. If you have questions about this, you can reach out to your caseworker. If you don't know who your waiting list caseworker is, you can call the intake line. There should be somebody, well, 2 people on every day from 8 to 5 that can answer any questions and give you contact information. You can also send an email to the DSPD info@utah.gov. We do have a few programs actually for people on the waiting list. We've got some temporary services that will be able to work with about 1,400 individuals. So funding is limited and it's not going to be available for everybody to receive services. People that have been selected to receive these services are based on need. You don't need to apply to receive these, and we will contact you if you do qualify for any of those programs. So we've got a few different programs that we've started. So one is 8 hours of respite a week for 1 year. That's going to be for around 370 people. We're going to start reaching out to people who were pulled in June or July of this year. We still have the ARPA funding. The first round of ARPA started in October and went through, it will end June 30th of this year. So our second round will start July and go through June of 2024. Those names have already been pulled, and we will also start contacting people about that in June or July as well. It's going to be about 664 people this year. We also had a one-time respite program that we offered that started in April and will end in June. It's about 375 people, and we have already contacted and opened most of those plans.
Thank you, Jamie. Now we're going to we should have Bryn and Lisa Wade online. They're going to talk about person-centered planning.
Thanks, Angie. Great to be with you all here today, and excited to share some about that, some person-centered planning tools and ideas people and services can use and expect really from their support team, as well as ways people waiting for services can access resources. We're sharing similar information you'll see today with your support coordinators, your staff, and providers and others. First, to improve in the areas we need to, certainly around person-centered planning, but also just to make sure we continue what's already person-centered, continue what's already working to support you and your family the way you want. There are 5 competencies, or a better word would be 5 skills that people supporting you or your family member should use when engaging or doing person-centered planning. We're going to talk about each of these skills in this meeting today and in upcoming meetings. We'll add a link to a document that describes these 5 skills in the chat. But today we're just going to talk about that first one, or that person-centered planning should be strengths-based, culturally informed, and focus on the whole person. I'll share that link in the chat. Okay, person-centered planning, we'll just go into the information here. Person-centered planning recognizes that any person can grow, change, and make decisions on their own and work towards the goals that they choose. Person-centered planning focuses on living the vision of a good life. Activities should always focus on understanding what you or your family member want, what a full life might look like for you, and not just the diagnosis or a disability. The skill also talks about planning that's shaped by the individual, their culture, and their identity. Good person-centered planning should respect you and your family's values, beliefs, customs, and traditions. So feel free to speak with and also educate your support coordinator, your providers, staff, and others on your family's beliefs, values, and customs so that they can better help you. Without this information and understanding, it can be hard at times to connect with and trust support coordinators and staff to help you in the way that you want. We have a few videos we'd like to share with you. They interview people that have gone through the person-centered approach and also those that support them. There may be some short videos that you can view on your own time. We'll put a link to all the videos in the chat, but we wanted to share just one with you today, and I believe there should be a link available to share that on the screen now. If not,
Are you wanting me to share that, or do you want me to stop sharing so that you can share it?
whatever's easier. If you'd like me to, if you want to stop sharing and I can share, that will work too.
Okay.
Thanks for giving us some time. So someone should chime in, let me know that they can hear.
My name is Misa Kwok. I
can hear it.
use she, her pronouns. I am a blind Korean American woman, and my experience with person-centered practices and my thoughts on that have been informed both by my personal lived experience as a disabled person and also professionally, having worked as a project coordinator for the National Center on Advancing Person-Centered Practices and Systems, also known as NCAPS, as well as my experience of teaching blind youth. I think my culture is certainly an important part of who I am. One, as a Korean American, I think I hold on to many parts of what my experience has been like growing up in a Korean household, and also certainly shaped by the experience of moving to the United States in my early adolescence. Also, I would argue that disability is a part of my culture. And so having been blind since birth, blind community has been a big part of my life growing up and thinking about my own identity and just my place in the world. So I think when we think of culture, there are multiple facets. You know, in my case, ethnicity immigration experience, disability experience, and so on. In terms of person-centered practices, I think this was not very apparent to me until I started working at NCAPS, in large part because this was not a jargon or vocabulary that was introduced to me until then. And I think part of that is because in Korean language and culture, it's rather awkward to say it. Having conversation with my parents about my job, I had to do some studying to explain that, but I think it was very initially unnatural to talk about this with my family in Korean language. And I think it's somehow almost counterintuitive. Korean culture and just ways of being is more collectivistic and more family oriented, more community oriented than quote unquote Western or American ways of life and thinking. Once I learned about it through my job and learned the kind of lingos that are often used in person-centered practice circles, it made sense because I think my parents emphasized being able to have self-determined life. To kind of merge this together, I think there is almost clash between my cultural norm and this notion of person-centered practices. One, because of the language, going back to that, and two, just ways of thinking. And I think even for my family, trying to navigate, my life, and for my parents, trying to navigate their life as parents of a disabled child, this is something we had to learn, this concept of self-determination, advocacy. And I think we're trying to make sense of how to merge these somehow seemingly contrasting things. So honoring the person while at the same time holding on to the values of honoring family, honoring community, and bringing those things together. And also, I think there is a layer of, societal expectation of fitting into the society, but at the same time trying to recognize the importance of putting the person at the center. And I think this is something that I have been trying to figure out and make sense of, how to find the parts that are working well and merging the two in a way that is easy to understand and easy to follow through for people and their families.
I'll wait and give a chance to load up those slides again, but I thought that was a good introduction to what some of these videos can look like. Certainly those testimonials and stories paint a better picture than I could just in a presentation. And there's many more from all different perspectives, cultures, lived experience. So I urge you to go look at the rest of that playlist. Go forward here. So continuing forward with this idea of understanding the whole person and being strengths-based and focus on culture, when we, meaning the Division of Services for People with Disabilities, talk to staff, support coordinators and providers and others about person-centered planning, we ask them to take time to learn about each person's culture and language. Your support team, and we say this because your support team can benefit by learning from you. We encourage and hope you feel free also to discuss and educate your support team and others about your unique language and culture. To be strengths-based, culture-informed, and whole person focused also means that we are presuming competence in everyone. By competence, we mean that each person has those strengths, those skills and abilities. The focus is always to start out believing that a person is capable and if they choose, believing a person can live independently, work in the community, and hold a valuable role in their community as much as they choose to and as much as possible. If person-centered planning is focused on the strengths and interests of the person, that also means the steps should recognize each person for their uniqueness and the value they bring. Your support team should always start with what the person can do. Again, applying those skills, interests, and passions in ways that benefit the community. Starting with what the person can do also leaves that room for growth and improvement. We have a few person-centered planning tools we'd like to share with you today. The focus on strengths and understanding you or your family member as the whole person, and really getting more into what that full life looks like for that person and for that family. We'll focus on culture, language, values, and beliefs in our examples. And the two tools, we'll share with you today are the Life Domain Vision tool and the Good Day, Bad Day person-centered planning tool. And I'll turn it over to Lisa to talk through those tools.
Thank you, Bryn. My name is Lisa Wade, and I work with Bryn on the Employment, Person-Centered Planning, and Community Inclusion team here at the Division of Services for People with Disabilities. The Life Domain Vision tool uses the idea of a domain, and by domain, we just mean that it's an area of your life or your family member's life. This particular tool has 6 different domains, including daily life and employment, social and spirituality, community living, and advocacy and engagement, among others. And you and your family member can expect some conversations to occur for those of you that are receiving services with your support coordinator and others on your support team in each of those 6 areas during or before your person-centered planning meetings. It's really about having a conversation about what you want in your life. These are quality of life areas. When we only focus on health and safety areas, there's a whole lot of a person's life that we're not even addressing. And so this particular tool helps us to look at all areas of an individual's life. And we'll put a link in the chat so you could access a copy of that tool. We could not share examples of all of the questions you might get asked about your vision of a good life in all of the domains, but this slide has some questions that you might be asked based on culture, beliefs, values, etc. To use the tool, all you need to do is just look at each of the domains and discuss what you want in each of those areas. You might need an explanation of what those domains mean, and there's a description given on the tool that can help you with those examples. And with each domain, there's an area to write in what your vision of a good life is. And then I love this part about this tool. There's a column for the priority level of that particular domain, because we all know that as life ebbs and flows, there are things that become more important at one time or another. So this is a good way to highlight the things that are important to focus on right now. And there can be more than one number one priority that you're working on, or something that's a high priority. This tool can be used separately for the individual with disability as well as their family. And then you can look at the 2 tools and how they come together, or where they are separate, and then have conversations in those areas that may agree. And in case there's any misunderstanding, these tools are available for everyone to use. You don't just have to be in receiving services to be able to access and use these tools. They're very helpful, and they are helpful for people with and without disabilities because they are universally designed. I'll have someone put our email address in the chat. If you have any questions about how to use these tools or would like some help, we would be happy to help you walk through these tools. The Good Day, Bad Day tool is a very easy tool to use, and it just helps you learn about what is important to each person, not just what's important for each person. And like I said, it's really easy to use. We couldn't add all the questions we wanted to on the slide, but tell me about a happy day. Tell me about a sad day. What makes you excited? What bothers you? Can you tell me about the times you've had the most fun? Who are you with? What are you doing? Those are some of the questions you may hear to build this picture of what a good day or a bad day looks looks like for an individual. This is a great way for you or your family to communicate what's important to you and how you most want to be supported, how you want people to communicate and interact with you. It's a good starting point for conversation, and it hopefully leads to other discussions and other person-centered planning tools. If we look at this tool thinking about culture and identity, maybe your family could fill out what a good day or a bad day looks like independently and then compare your answers on that. And as a reminder, person-centered planning tools are helpful when people are receiving services, and hopefully will be done yearly at least with your support coordinator, but they're also very helpful for those waiting for services. And we've shared links to our training. We have a 5-webinar series on how to use these tools, but we'll put the link in the chat again for you to access. We'll summarize person-centered planning that is strengths-based, educated by culture, beliefs, and tradition, and understands that each person is whole and competent by this quote from Christopher Reeve. Superman, as I always think of him. So many of our dreams at first seem impossible, then they seem improbable, and then when we summon the will, they soon become inevitable. And I think this is a great quote because it reminds us not to place limits on any person, that we believe in their capabilities, that we keep in mind to look beyond their diagnosis and the disability and keep their expectations high and equal to their peers. And with that, I'll turn the time back to you, Angie.
Thank you, Lisa. Next up, we have Jenny Dopp with the Utah Parent Center. We're really grateful to have them here with us today. They're great partners. And she, I think, will be taking our presentation down so that she can get hers up.
Yes, thank you so much. Let me just make sure I can share here. I just have a few slides to share with you, and then I wanted to show you about, I want to show you a great tool that has been about 6 months in the making. Can you all see that slide? Okay, perfect. So first of all, HCBS, that's kind of a different term. As a parent, I have a son, Jackson, who's 22, and he's on the wait list, and he's been there for quite some time. And I had never heard, when I was a new mom, getting him on the wait list, that term HCBS. And so this information that I have to share with you today will help some of you seasoned parents, but also maybe parents like me who are not as familiar with waiver services, how people can best utilize these services and how it will help them. So we've established this guidebook that is explaining HCBS, or Home and Community-Based Services for Families. I am Jenny Dopp, as Angie said, and I've been with the Parent Center for about 14 years, and I'm also a mom. And so I feel like I've been in the trenches for about 22 years, and I feel like I have an intimate understanding of some of these services and how families so desperately need them. But I work on the special projects team, so I get to work on this project and also Transition University. So if you have youth who are transitioning to adulthood from their ages 14 to 22, 26, we help them understand what resources are available for them for employment, transportation, healthcare, all of the things. So reach out to me if that sounds like something that you might be interested in. Before I show you our guidebook that's brand new this week, I wanted to just give a little plug for our Family to Family network. For all of us who have been on the wait list, or maybe if you're in services, the Utah Parent Center has active networks throughout Utah to provide support and information and training. And so these are all of the places that we have active networks. If you would like to participate in a network that you don't see listed, please reach out to us, or if you want to be a co-leader, that would be great too. So this is the guidebook that has been about 6 months in the making. We were able to obtain a grant to help us develop this for all of you, and it's written from a parent's perspective. So I know that there's a lot of different people on this call, and there's support coordinators or providers or disability advocates or parents or self-advocates, and this is written in a way that anybody can understand it. You don't have to be up on all of the lingo or all of the terms used in the disability community to understand it. We really wanted a tool that would be a good resource for families so that they could understand all of the different components. So I'm going to stop sharing this screen right here, and I want to jump over to the book. And when we first started developing this book, it was just going to be a few pages so that people could understand things like the settings rule or what a support coordinator is. And as you can imagine, for those of you who have been involved in this community, it's quite complex, and it takes a little bit of time to understand all of the different pieces. So this is finished, but we are also taking comments still on it. For those of you who have been on the Facebook page for DSPD, for parents or caregivers, we've asked for feedback, but it's still possible for you to give feedback. So I will put a link in the chat in just a little bit, and you can go into this file and just click on a section and add a little comment right there like that. If you see something you love, something you hate, something that maybe isn't clear, we would still love to get feedback on this. It hasn't been published in a hard copy yet, but it will soon be on our website this week. So I just wanted to show you, I just have a few minutes, but we take you through all of the different areas that are involved with waivers. And we've put a little tool right up here, a little legend, for you to understand which section you're in. So whether it's information or navigating, DSPD right here, maybe a support coordinator, so that as you're in the book, you won't get lost. But we take you from the very first phone call that you get from your DSPD transition coordinator. Congratulations, you're off the wait list. And this is a little quote from a family where they said, I just don't even know what I don't know, but I'm so excited. There's all of these things that are available to us because these families have been white knuckling it for so many years. And then we take you through the basic language. What is a PCSP? That's a new term for a lot of people. What is an SCE, a support coordinator? What does it mean? What is a settings rule? And we also take you through, we have to understand where we've been in the past in order to help us navigate for the future. Understanding what the Olmstead decision was, the Katie Beckett waiver, because I think a lot of times, and I know I've done this as a mom, as I've tried to advocate for Jackson, I didn't really understand how it was before. So I couldn't fully appreciate where we are now. And it would help to formulate a vision for me of where I want Jackson to be in the future and help him advocate for those rights. So we take you through the history of disability services. And then we get into this thing called the settings rule. And we break down the settings rule. We list all of the different 12 rules for you and explain them, because I know it can be, it might seem overwhelming. So we take you through an FAQ section so that you can see exactly how each rule might apply to your scenario, whether it's maybe where you live, where you work, what type of community outings you want to have. And I think this is really powerful. This will be a great tool for parents to utilize with their support coordinator, with their providers, so that as you're having discussions, you can be informed and you can be educated. Because as a caregiver, when you have the tools, then you can not only do a better job of advocating, but also have a more fluid conversation and build those relationships of trust and understand how you're a partner working together to make the best outcome possible for the one that you love. We also talk about a few topics like guardianship and how that might come into play with waiver services, especially as a parent. I know I'm not going to be here for Jackson forever, and so I want to make sure that I have tools in place. We also list alternatives to guardianship like power of attorney, supported decision-making, and we link off to a lot of our other resources within Transition University to help parents. Then we get into the Medicaid waiver options. Again, I've never been allowed to play in the pool yet because Jackson's still on the wait list. So if I were to get into services, I wouldn't quite know what was available to me. And I know DSPD does a great job of explaining that to parents, but if, as a mom, if I had this in front of me, I could say, oh my gosh, okay, this is something that we definitely need. I didn't even know this was an available resource. So we go through and we take each waiver, so the acquired brain injury waiver, and we explain all of the services on the waiver and link off to the resources with DSPD. And then we also talk about the settings rule for each waiver and how that can apply to you, because this is a great tool for us as parents to use to make sure we're tapping into the most to the resources that will help our youth and our the ones that we love access the community and be a part of it. So it's important that we understand like the CSW waiver, community supports waiver, everything that it entails, and then again, how we adapt that to the settings rule and how it applies. So I'm going to jump through all the waivers here because there's quite a few. We include like tech dependent waiver, physical disabilities waiver, MCCW, they all are in the book. Okay, this has been a labor of love, and I'm going to shorten this just a little bit, but this helps families understand the process. So this is you right when you go through the wait list, get off the wait list, and how you're talking to DSPD, and then right here where you're trying to find a support coordinator and everything your support coordinator is supposed to do for you, because you don't understand that's their job. You're not bugging them to, you know, if you need something, your support coordinator is there to serve you. And then we get into whether or not you want to use a self-administered service or a provider, fiscal agents, caregiver compensation, all of that. And we even include case studies so you can understand how that whole process worked for Ben and how Ben established all of those things. We get into things like the job of your transition coordinator, what services are available, what are service codes, what do they mean? I'll blow this up for you just a little bit. We get into each area and list the service codes that are available for you. And I want you to know I didn't just make all of this up. We've had great partnership with DSPD on this book, and they've had a lot of input and helped correct things and add things. And we've had support coordinators work on this book. We've had providers work on the book. Fiscal agents have reviewed it and vetted it. We've had the Disability Law Center work on it with us. Lisa Thornton is another attorney who's helped. Bryn and Lisa that you've heard from on this call, and Marcy Platt. So many people have helped create this book. Understanding budgets. A nurse care manager, that's a new term and it's only used for certain waivers, but we wanted to include it. How do I find a support coordinator? What's their job? I have so many questions. How should I interview them? What should I ask them? When we jump to, we list all of this information here about support coordinators and also your job. What's your role as a family? How can you work? It's kind of like that IEP, how to be a partner in the IEP process when you're going through school. But how does that work with support coordinators? And also the grievance process. We want to make sure that parents know and caregivers and also self-advocates know that there's choices available and that, you know, it's possible to change your provider and change your support coordinator. And we list all the information here at the bottom for DSPD and how to register those grievances or problems, because we won't know that something needs to change in the system unless we share. So I have about 2 more minutes, but I just wanted to jump ahead. We get into the different models available to you, whether it's a service provider, self-administered services, caregiver compensation, or a combination of both. And then that provider model, what's the difference? Like as a mom, what should I choose? Should I choose a provider? Can I do it myself? How do I hire my neighbor? We teach you all of those things. We link off to the SAS books and how to find caregivers, because that can be challenging in today's world. We go through fiscal agents and what are the responsibilities of fiscal agents? They're one of your providers. What should you expect from them? And then also, I worked with one of our providers to create this piece on providers, and he gave me this great piece right here on green flags and red flags when you're finding providers. These are things that you should know because you've never, again, utilized providers before. So how would you know what to look for? What are the warning signs? What makes a great provider? And then after that section, we jump into this really important piece about person-centered support plans and why this is a huge key and a benefit to you as a user of as a Medicaid waiver, why they're so important. Again, we take Ben and we walk him through his PCSP meeting and also teaching Ben about being a self-advocate and that he gets to lead his meeting. We talk about the support star and these great tools that are available with Charting the Life course and how to lead your person-centered support meeting, who should be invited, that you're entitled to invite anybody that you want to, how to make goals, what are the things that you should include in your goals, and then kind of a checklist here at the end to make sure that you're including things like employment or education, the things that you're interested in, and what makes a really good plan right here, this checklist. And I don't have time to show you the rest of the book. It's 104 pages, and we made it through 80 of these pages. But I will make sure the link, if it's not already been added to the chat, I'll make sure and add it so that you'll have it before you get off the call. But I would love your feedback on the book. Again, it will be on our website this week. And then we hope to be able to find somebody to help us publish it and get this into the hands of the families that need it. But at the end of the book, we have a vocabulary list of all of these acronyms that are so hard for us to understand. We also include things like Medicaid, Social Security, maintaining your eligibility, how important that is, how caregiver compensation might impact your eligibility or might impact different areas of your life with other benefits. So we not only cover support coordinators and providers and PCSP, but all of these other little pieces to waivers that some of us are not as familiar with. So we're excited with this. Is never, as far as we know, this has never been done before, to pull everything all into one place and written with families in mind so that they can understand it. And so we hope you find it valuable, and please let us know if you have any feedback. Thank you so much for letting us share that.
Thank you, Jenny. And my gosh, thank you for all the work that went into that resource. We're gonna go ahead and move into our question and answer period. We had some questions emailed ahead of time. So we'll go ahead and start with those. Okay, let me take a quick break because I saw Shailene, if you feel free to go ahead and go. Thanks for raising your hand.
Sorry about that. I was curious. My friend called her waitlist worker, and her number is somewhere in the 220s. And the waitlist worker, she said she got off the phone with the impression that her number reflected after the poll for for the year 2023-24. So like the 19 per month, which is in the 220s as well. So it was her understanding there was no hope because that number reflected. And I didn't think that was right. And I just didn't know if we could get some clarification there.
I'm gonna hand it over to Jamie Douglas, but it's also something like maybe you just need to have a one-on-one call, but Jamie.
Yeah, I mean, it really depends on a lot of things. I probably need to look. Can I contact you, Shailene, and we can have a conversation so I don't give any wrong information. I have some time to look at it.
Sure.
Well, I'll put my contact in the chat and then we can set up a time. Does that sound okay?
That's fine. Thank you.
Thank you. So for questions that were emailed in, the first one is there funding for my daughter to attend tech school for training, even though she's failed previous attempts at employment? So I'm going to have Bryn Peterson answer this one. Bryn?
Sure. So yes, there is funding available, but it's not directly through Division of Services for People with Disabilities. We do like we've talked today, we do a lot of person-centered planning tools on employment and various assessments that can help identify those needs or supports. But additional support for help for education that will lead and further a career can happen in two places. First would be the disability resource centers at colleges and institutions. And the second would be that vocational rehabilitation has a full track for folks that want to start with education as that first step towards their future job. You would sign up at your local VR office. And we'll put a link in the chat here that'll give you a toll-free number, as well as an office map if you're not sure what the closest VR office is to you.
Thank you, Bryn. Shailene, I don't know if you have an additional question or if your hand is still up from initially. I see Laura Larson also has her hand up. You feel free to ask your question.
My question is, are there any plans in play to create like a resource where we can just log in to see our status on the wait list? Maybe report in any changes or anything like that so that we can also see any benefits that we should receive. I don't know. It just seems like there's a lot of phone call times, and I work full time. My husband works full time trying to make ends meet. And it'd be really great if we could log in and see that at 10 p.m. and not try to catch somebody on the phone.
Yes, let me give the time to Jamie Douglas again. There is a resource for seeing where you're at.
Yeah, so we have a system called My Steps where you can actually get access to some of the information. It will give you some basics, but will also show you waitlist ranking and your caseworkers information. We do have the ability to meet after hours too if you need to send us information, if we need to arrange a phone call. You can also talk to your waitlist caseworker. You can email and or text information in if that's easier, if you're not able to meet throughout the day. Feel free to take my information from the chat too if you'd like to have a conversation after you're done working, and we can make sure that you get everything updated that you need.
Thank you very much.
Thanks, Jamie. Another question that we had mailed in prior to the meeting is, what is DSPD doing to hold agencies to things they agree to? Things that they say they can and will do at an intake meeting, for example, and then just fail to do them or offer excuses, rationalizations, and explanations. So there are a few things that we can cover here. So one, the Office of Services Review does an audit of every single contractor every year to assess contract performance. So they'll be completing that assessment. And if anyone wanted to like elevate a concern to them, they have an email. It's OQD provider quality at utah.gov. And we can get that in the chat so that any concerns can be shared with them. Also, a family or a person we serve can contact our constituent representatives at dspd@utah.gov. Our constituent representatives can help you navigate, address concerns with the agency you're working with. And they'll also work closely with the Office of Services Review to address any concerns that are related to contract performance. And just please know that people can change their services, like their service provider agency, at any time. A contractor has to give a 30-day notice. This is to help assure continuity and that people don't go without services. But for families and people we serve, that you don't have that requirement. It's just a contractual requirement. The next question we have is, what can you do if your support coordinator does not put things in the person-centered support plan that you expressed and wanted included in the plan and the goals? I think that is a great question, and it elevates for us. One of the things we're going to look at is the timing of signing the person-centered support plan to make sure that you're able to see what's in it before you are signing it. Also, in this scenario, if you need to work through a resolution with your support coordinator, please reach out to our constituent representatives. And again, contract concerns can go to the Office of Services Review at their email address. Bryn or Lisa, I know you guys work a lot on kind of person-centered planning. We have the pilot to be getting feedback from people on how that planning goes. Do you have any additional information you think would be helpful?
Lisa, if you want to jump in with more, I think we're really just looking for engaging the individual's experience and the family's experience in person-centered planning. With this pilot, there'll be a few questions, and we gave that email address at the beginning. So if you want to be involved, reach out and we'd be happy to answer questions.
And of course, we always encourage using the person-centered planning tools, and you don't have to wait for your support coordinator to help you do it. You can do them without them and then show them the end result, and that should get added to your plan as well, which may help lead the conversation.
And Lisa, I think those person-centered planning tools they're already available online if a family wanted to be able to look at those.
I can add the link to the chat.
Yes, we have a whole page on the website currently dedicated to person-centered planning, and there's a variety of tools. There's a workbook for individuals and services to help them prepare for their person-centered planning meeting. All of the person-centered planning tools that DSPD encourages using are there and available. There's the webinar series, so you can watch a video about how to do it. And of course, we're here to help as we are needed.
Thank you. Okay, one more question for you that's coming from me. Do you guys still have office hours where people can like sign up if it's a time that works for them?
So we currently have office hours for support coordinators to use the
Okay.
new software, but we don't have for families and individuals. If that's something that people want to set up, though, we're happy to meet with families to help them go through the tools.
Awesome. Thank you.
Do we have that email in the chat to request a one-on-one or an office hour time?
We can put it again.
Okay, we'll get on that right now. Hold on. In the chat.
Thank you, Lisa and Bryn. We definitely want to make sure people are the ones driving their plans. So thank you for the questions and the opportunity to be like making sure we work through our processes so that they're supportive of families and people with disabilities. The next question is it possible for families and individuals to have access to exactly what the agencies are accountable to? So each agency, so there is a contract when there's a contract for support coordination, and that contract has in it what is expected and required from support coordinators. The same with providers. Those are open contracts, so they're visible. I know they're not always easily visible. So I do think when I read this question, it just kind of highlighted to me, we probably need to get some feedback from families on the easiest way to access information and like be able to understand what those requirements are and what you can expect out of your service provider, your support coordinator, the agencies you're working with. So I do think that is a great question, and I feel like we've got to do some work and get some feedback on how to make that really easy and accessible. I had mentioned at the beginning we're looking at how to make our website useful, accessible, easy to navigate. Like if you do that survey and this is something that would make sense to have in there, please get that feedback there as well. So I don't have a quick and easy reference for you today, but I appreciate the question so that we can really evaluate how to make that available and easy. Okay, our next question is another one for Jamie Douglas. The question says, is that July 1, 2023 or 2024?
I'm going to try to answer. I'm going to put all of the information together. And if the person that asked this question, if I didn't answer something, please let me know. But I think what you're referring to is the fact that we'll be bringing in 19 people into services each month. I did also want to mention too that funding is going to be reviewed throughout the year to make sure that we stay within the amount the legislator gave us for waitlist funding. So that's why we are working a little bit slower than usual. We've done that the last 2 years, but people who are getting transitioned into services now will start those funds on July 1st of 2023. You know, it gets a little confusing. Our year end date is the end of June, and July 1st is our new year. So that would be fiscal year 24. We also have the ARPA funds and the respite only program that will be starting in June and July, and we'll be contacting people about that as well. And that's June or July of 2023.
Thank you, Jamie. Our next question is, will caregiver compensation be available from June through November as you make changes and finalize the new program? Yes, it will still be in place. We have the funding for it. We just know that as we get approval for something that's ongoing in our waiver and we have to change from operating under the Appendix K, that there will be some changes and some differences. And we want to make sure everyone has that in mind as they're planning and just know that it may not look exactly like it looks today, but you will still have the service between now and November 1st. Our next question is, I am curious how long the wait list actually is. I advocate for my disabled sister, and although she is high functioning, it does not appear that she will come off the waiting list anytime soon. So our waiting list, and I'll let Jamie Douglas jump in too, but our waiting list is based on most critical needs. So the needs assessment questionnaire that is done annually determines the ranking on the waiting list. And hopefully you all know that you can update that at any time. So if you have a change in circumstances, please update it so that your information is always accurate. As a result, because it's based on has historically been based on most critical need, someone could be on the waiting list for a very short period of time, like less than a week, while someone else can be on the waiting list for up to 30 years, because those needs have an impact. We recently have been authorized to have what's called a limited supports waiver, a much more limited scope of services that looks at, it's kind of the opposite. Instead of the most critical need, it's looking at a lower need, right? We need to make sure that your needs don't exceed what's available in that waiver. And then from that waiver, for people who are in that category, we then look at who has been waiting the longest. But Jamie, I'm going to give time to you because this is something that I think you help explain all of the time and can probably do better than I do.
No, you did a good job. I think there's not much to add to that, Angie. It's just, it is based on need. I do think the limited supports waiver, having that information and kind of understanding how that waiver works is helpful as well, because it is limited funding, but it's intended to give people who may not have the most critical need, but still have needs that need to be met to be more independent. So 5 years is the average wait time, but I hesitate even saying that just because it's based on so many other factors. But I do just want to remind people, though, that updating their needs assessment at any time is very important so that we can make sure that everyone is ranked appropriately on our wait list.
Thank you, Jamie. I think this next question is best for you as well. It says, so the people that are on the wait list and will have the opportunity to receive temporary services may not have been contacted yet?
So for the ARPA funding, that will start July 1st, and for the respite only funding that will also start July 1st, we have not contacted those families yet. So we have contacted people who are using the one-time respite, which is just from April through June.
Thank you. The next question is, during the last session, I asked a question about how DSPD knows it is using the funds allocated in the most efficient and cost-effective manner for the services that are used. The answer given was that the support coordinators were responsible for this. I talked with my support coordinator and was told that they had never received any information or training on this, and that they basically were price takers. Whatever the entity that they were attempting to use was setting the price they had. So that is really good feedback. And I do think this aligns, like, I don't know if any of you had the opportunity to look at the audit that we received from the Utah Office of Inspector General. So within our system, support coordinators have the role of getting services set up, making sure they're the right services, addressing issues, and really working within what needs are and making sure it makes sense, right? We want people's needs to be met, but we also want to be conscientious about the fact that we do have a waiting list. So we want to be really responsible with how money is being spent. When support coordinators submit a request for additional services, it is reviewed by a team that is separate from, right? They're not providing support coordination themselves. And they do review based on criteria. We are also looking at how to incorporate a couple of families from the waiting list to be part of that review and assessment team. But as I was mentioning about our audit, like, one of the things it does talk about is how are we assuring that services are the right services, right? The right amount, but also not beyond what someone needs. So that's something that we're working on, and getting this feedback from you is really going to be helpful for us as we leverage that that audit so that we can really make changes that have positive outcomes for both who we're serving and who is waiting for services. So thank you for that. I feel like this next question is another one for Jamie Douglas. It says, how do you update the needs assessment? Is it online?
So the needs assessment is not online. All of the waiting list caseworkers reach out to everyone on their caseload, which is 600 to 700 people, starting usually in March and ending in December. So you can reach out to your waitlist caseworker at any time to make updates to your needs assessment, and just know that they'll be reaching out at least once annually to update that assessment plus the waiting list survey.
Thank you, Jamie. Our next question is, I'm a single parent with 2 autistic children on DSPD services. Will there be any services just for single parents? We don't have any services that are limited to only single parents, but all of the services that we have, right, it wouldn't be contingent on whether a person was married or single. So it would be based on the need of the person receiving services, what services would be available to them. And I feel like I'm probably not fully understanding that question. So definitely feel free to either give us a follow-up question, or it sounds like it probably needs to be something that's a little more individualized. So please feel free to reach out. You can reach out to the DSPD at utah.gov or the DSPD info at utah.gov, and we can follow up with you. We don't have any more questions that were sent in or written, so I'll just give a minute or two for for people, if you have a burning question, give you a minute to think and ask it. Yes, Marilyn. Marilyn, if you're talking, I think you're on mute.
What is the process for changing your support coordinator if that were something you wanted to do?
So you could just, sorry, go ahead. So if you want to change support coordinators, you can just reach out to dspd@utah.gov. One of our constituents will get that email and reach out to you to help you make a change.
Okay, thank you.
You bet. Okay, next, we have a question that says, how many people are doing casework at DSPD? I feel like I'm going to have to count up those numbers. I think, so Marcy, I'm going to, you're probably going to need to make sure I give the right number. For people who are transitioning out of an intermediate care facility, we have 3 people who are doing support coordination with them for 1 year before they transition to a contracted support coordinator. Did I get that number right, Marcy?
We have more than that right now, but 3 are permanent positions.
Oh, okay, thank you. And then for people who are coming off of the waiting list, I believe it is 9 staff who do support coordination. They do not keep a caseload though. They are helping people get their plans developed, set up, choose their services, choose their support coordinator. So they're very transitional, as you can imagine, with 9 people, that it's going to take, their time is going to be focused on getting things set up, and then a contracted support coordinator would maintain the services. Our limited supports waiver, I don't know if Tyler or Anna are on here.
Yeah.
Oh, perfect. How many support coordinators?
We currently have 4, and we're in the process of hiring 2 more. Oh, looks like Anna's on too.
Oh, perfect. And so our role is not, in most cases, to be doing the support coordination. We do it for the limited supports waiver as an ongoing support coordination service. So I hope that answered the question. Oh, I might have missed this. Did you answer the question of how many people are on the wait list? I may have missed it. Jamie Douglas, I know you were just looking at that. You might have the most current number, or Tyler.
Yeah, there's about 4,800 people on our waiting list right now.
Thank you, Jamie. And we have a question that is, how can we get more funding? So if you need additional supports and services, you would work with your support coordinator, and they submit what is called a request for additional services. And with that, they're explaining what the need is, providing information to support that increased need, to request additional funding for that. Kristen, I don't know if you are on as well, if you have anything to add there.
Yeah, I'm on. No, I think that answer is great. I wouldn't really have anything to add to that.
Okay, thanks.
Someone clarified that maybe the question is from the government. How can we get more funding?
Okay, I will attempt an answer. So if the question is how do we get more funding to bring people into services, each year our division, like right through the executive branch, through the governor's office, has been able to ask for additional funding from our legislature. The legislature is who appropriates funding in the end, right? They're the ones who determine where the funding goes. So, and we have like this fiscal year 23, so 22, 23, the 22, 23 year, we had the highest amount of funding we've ever received from the legislature, which has been amazing because we've been able to bring in close to 400 people through that funding. And we received funding again this year, which has been, right, it's just makes a difference to be able to bring people into services. We do, even as we get funding, see our waiting list increase. So I know that like advocacy from parents, sharing stories and information helps inform legislators who are determining funding and appropriations. And I think I see Katie's sharing in there. There are advocacy organizations that really focus, like they have relationships with legislators. They are great advocates. They're great at organizing and bringing families and people together. So they're great resources to reach out to get more information on like how to follow up and advocate for that. So hopefully I got, is there a committee to target? The Social Services Appropriations Subcommittee is the committee that our division presents to. So Social Services Appropriations Subcommittee. We have a question that says, under caregiver compensation, what is DSPD's preference in providing the services, SAS or provider? Or what are most families using? What does the future model look like after 7/1/2023? So those are like some of the questions that we're answering right now. We know that most people do use SAS, but we don't have a preference, right? What we want is for it to, we know we need to be accountable with whatever mechanism we're using. We're going to need assessments. We're going to need to be able to define extraordinary care. We also need to look at like, how is our funding appropriated? What kind of money do we have to cover costs? So we don't have the model defined for starting in November. So starting in July, because we won't have a waiver amendment, we will still be operating under our existing Appendix K authority. So it will still look the same. But by November 1st, we'll have to have it in our waivers, right? Have that as an ongoing service allowed in our waivers. So we're working on amending the waivers. We're working with the Medicaid team on that. And we'll be updating our rule so that it reflects that we have this ongoing authority in our state now, right? Our state has said, yep, we support this. And we have to also be working with like, what does that look like? So anything we propose to the Center for Medicaid and Medicare Services, they have to approve what this looks like as an ongoing service too. So we have gotten a lot of feedback from families and we continue to get it. So if you have like needs or thoughts, please feel free to share them. You can keep sharing them through dspdinfo@utah.gov. Because we're taking everyone's feedback on that. So thank you very much. And Kristen, I feel like I must have misspoke. So our finance officer is going to help me out.
You're fine. No, I just wanted to make one quick clarification where we don't have a preference if it's SAS or provider. Right now, if you are going to be requesting it through the Request for Services Committee for additional funding right now, It does need to be under that SL3 code, which is a SAS code. That's how the system's set up so that we make sure all the criteria is met and all of the authorizations are there. So just if you're, for now until the new program starts, if you are requesting more services, just use that code.
And then they're still able to then access a provider model, right?
Right. If they want to then transfer that funding to SLN or, using that budget neutral process, you can, but the code to request it is SL3.
Right. Thank you for that clarification, because that's the one that is clearly a caregiver comp code, and that's how we're able to track and demonstrate that we're using our funding as appropriated. Thank you, Kristen.
Angie, you're muted.
Thank you. Okay, Jamie Douglas, this next question is for you. It says, I think I missed the answer for how to update the assessment. Is it online or by phone with the waitlist contact in the My Steps system?
So you can call the waitlist caseworker. If you have access to My Steps and you see who your waitlist caseworker is, you can call them to update or email them to update your needs assessment. You can set up a time for a phone call or email or text, whatever works best for you.
Thanks, Jamie. Again, I'll just give a minute in case people are organizing their thoughts. Okay, it looks like, at least for the moment, we don't have additional questions. Just thank you for coming. Our next self-advocate and family gathering is Wednesday, August 9th. And just a reminder that you can find information about our past or upcoming meetings on our website under Be Informed and Be Involved. And I'll just, since I've mentioned our website, just throw out a reminder that if you have feedback on like what works, what doesn't, how accessible it is, please, we really are looking forward to that. So complete that survey. And then our Disability Advisory Council, the next meeting is Tuesday, May 16th from 2 to 4, and the public is always welcome to attend, listen, comment, or bring concerns. So thank you very much again for your time, and I hope you have a great day. Bye.